All right, well, let's get you into our next panel session. And I'm going to introduce our moderator for the session. And the session is called Impact Through Partnerships. Dr. Mark Robinson is a Senior Research Fellow for the Institute for Social Science Research at the University of Queensland. And joining Dr. Robinson is John Kotzas AM, Queensland Performing Arts Centre, Sandy Murdoch, Attraction for Young People Limited, Adjunct Professor Sue Hawes, Diabetes Queensland, My Health for Life, Tiani van Haren, Department of Tourism, Innovation and Sport, and Robert Hoge, Department of State Development, Infrastructure, Local Government and Planning. Please make them welcome.
Thank you, Loretta, and good afternoon, everyone. It's such a privilege for me to be at today's symposia and to be kicking off this afternoon session. I'd like to start by acknowledging the traditional owners of the lands on which we meet today, the Yagara and Turrbal peoples, and pay my respects to their elders past, present and emerging, and to extend that respect to any Aboriginal and Torres Strait Islander peoples here today and who might be watching online. As Loretta said, my name is Mark Robinson. For the past week, I've been asking my wife and 2 kids to call me Graham Norton for obvious reasons. And while I work full-time at the Institute for Social Science Research, or ISSR, at UQ, through a research partnership that we established with Health and Wellbeing Queensland a couple of years ago, I spend at least a day a week in the offices of Health and Wellbeing Queensland at Milton Green. So I very much feel part of the Health and Wellbeing Queensland team, and I very much feel part of the organisational journey that they have been on. And that was recognised last week when, with the approval of the Chief Operating Officer, I returned home with not 1 but 2 Health and Wellbeing Queensland polo shirts. So it was a big personal milestone for me. And I like to think that was in part because of the success we've experienced as part of this ISSR Health and Wellbeing Queensland partnership. So just to give you a flavour of that, we co-developed a monitoring, evaluation and learning framework, some of the content and design of which has influenced the Queensland Obesity Prevention Strategy. That's out for consultation at the moment. Please go and have a look and provide your comments, particularly based on the very engaging session we had this morning. We're also supporting Matt Dick and his team to evaluate pick of the crop, which was mentioned earlier during the cooking demonstration. And we're also leading the evaluation component of Health and Wellbeing Queensland's new strategic management approach to how they work with their programme partners. So all of those programme partners are out in the foyer. It's great to see them all. And together, by working closely, we are helping to enhance the utility of the reporting that they do and to better understand the difference that they're making, both individually and collectively. And such impact that I've just talked through is the focus of this On the Couch panel discussion. So for the next 45 minutes, we're going to discuss the value of partnerships within health promotion and how we can elevate connections to make a meaningful and sustained difference to the health and well-being of Queenslanders. So Robbie touched on this earlier. He said he spoke about the importance of partnership and the work that he's doing. And Rob also mentioned that together is the key. So that's going to be the focus for the next while. The panel has been introduced and I was given instructions to introduce you, so that saved us a couple of minutes, which is great. What we're going to discuss is what it means to partner well and with whom for the greatest impact at all levels of the health prevention system. And those levels have been discussed throughout this morning's session. The conversation will, if I do a good enough job moderating, cover how to make partnership decisions, how to evaluate partnership success over and above the distribution of polo shirts, and how to report on such success to key stakeholders. The importance of locally led, community-driven and place-based partnerships will also be discussed. And throughout the conversation, I'm hoping the panel will draw on their own instances of impact and from their own examples of collaborative partnerships that they have been involved in. So, without further ado, let me ask the first question. So, the first question today is, what are the key factors to consider when establishing an effective partnership? John, closest to me, we are in your backyard, so to speak, as Chief Executive of QPAC, and thank you for bringing us into this beautiful space. For you, John, what are the key factors to consider when establishing a partnership?
Thank you, and good afternoon. I'm beginning from the premise that irrespective of what your access to resources are, they're limited. No matter how well funded you are, no matter what resources you have, what you want to achieve is more than what you're capable of. So I think what I want to address is probably 4 principles that we begin with. Firstly, thinking long term. Secondly, being clear on the objectives that we want to establish. And I can't stress that enough, being clear within your own organisation what you want to achieve. The third then is alignment. Who will help, what organisation, what individuals will help you achieve that? And then with that alignment, how close are your objectives and their objectives to actually achieving a similar outcome? I'm not necessarily talking about win-win, but I am. It's talking about how you expand what you're both trying to achieve in a way that's seamless. And then the fourth part is how do you review that? I'm not necessarily talking about reviewing and measuring at the end of a project. I'm talking about along the way, what are the conversations you're having? How often are you in engagement with each other, understanding each other's objectives and how the day-to-day things that you're doing are affecting the long-term outcomes that you want to achieve? Can I just leave it at those 4?
You can, thank you. It's a great introduction and covering some of the principles that we're planning to mention as part of the series of questions. I'm not necessarily going to go in order, but Sandy, I'm keen to come to you. So Sandy's Chief Exec and founder of Traction for Young People, which is a for-purpose organisation. And obviously partnership must be crucial for you, Sandy, in terms of working in that community space. So what are the key ingredients for you?
I think they've changed over time, Mark, but I can remembering starting Traction, like we were scrambling to figure out how we could make an impact and what our programs looked like. We partnered with anyone who we thought could help us in terms of people that had experience working with young people. Schools, for example, we really sponged learning and took input from them about how to better engage young people and what some of the challenges that their young people faced. We were obviously trying to get dollars in the tin in terms of partners who could be supporters with us. I guess we always came back to that alignment of, I guess, a focus on the young people we were trying to support, but also values and, I guess, ways of working and a commitment to communication along the way, and I guess working towards some objectives, and those things can change. But I think the values is, for us, really important as a for-purpose organisation, try and create an environment and build a community around our young people who are at the heart of it. They're probably just a few, but we've learned also, like, resources are limited, so capacity. At times, we as Traction haven't had the capacity to undertake partnerships that for us were alluring and exciting because it could take us into new opportunities and new territory. But we've always had to be very careful when partnering as to when we're ready. Yep. And likewise, are the others that we're working with also ready to, I guess, embark on the next sort of chapter of learning. So, I mean, we always want to have a crack. I'll just say that. Yep. It's part of our culture, and we're always learning from others and trying to partner with others who have got more experience in what we're doing. And what we've found in that actually is that there's a lot of patient partners out there who can see the gaps that we have had and are willing to suggest where we need to develop our capacity. And those nudges along the way, some more like uppercuts to the jaw, more direct. For example, you guys have got to have a program evaluation framework in place. You've got to be able to demonstrate what your impact is. Get your instruments going. Like when we started, we didn't have that. Yeah. But partners encouraged us to invest in doing that and got behind us to do so, and that has really helped us.
Great. Thank you. So a couple of themes that came up there was the alignment of values and the alignment of ways of working. Robert and Sue, you have both been involved in the COVID response in different ways. Robert in Queensland, Sue in the NT. How do you ensure alignment of values and ways of working when you're thrust into a situation that nobody quite expected, and what can you learn from that type of managing that type of situation?
Thanks, Mark. Before I was in this role, I was head of strategic communications in Queensland Health for 6 years, including the first 612 days of the pandemic, which was quiet time, really quiet time. I think probably, and certainly a couple of examples there, really quickly, we got all of the state health departments together the Federal Health Department communicators together. Obviously all of the chief health officers were working together, caucusing sometimes to try and get politicians over the line to do various things. But we were all talking at the communications level with different responses, different political parties, and it was a really good conversation in terms of really leading with the values. What are we all trying to do? We're trying to save lives, reduce impact, get as many people through this as well as possible. So I think coming to that with a really good sense of values is really important, and putting that on the table and using that base to try and get through some of the challenges is really valuable. And I think in terms of what Health and Wellbeing Queensland is trying to do, and indeed has to do, and what all of you are trying to do, I think that the response is probably harder than COVID. I think it's harder than COVID, and COVID was hard, but this is harder, and probably a little bit easier than the climate change and decarbonising the economy. So that's where I think it's pitched. And just one quick example of shared values. It became really obvious early on in the pandemic response. Queensland Health had thankfully built up a really good content team. What we were doing on our social media channels was working. We'd hired well for that. And 2 states started stealing our content. They were taking posts, rebranding it. And of course, it's all in the greater good. And I won't tell you which states. One of those states called us up and told us and said, "Oh, look, you might have noticed we've been stealing your stuff." We're like, "Yes, we noticed. But that's great. Can we chat and share information, share data? What can you see that's working?" And having that good values-based conversation was great. One of the other states kept stealing stuff, didn't talk to us, and we didn't get the opportunity to share info.
Okay. And Sue, anything to add?
I guess from a learning perspective, if I reflect on the COVID experience that I had in a leadership role in the Northern Territory, probably 3 key things that I take away that are, so the first is definitely about communication, goes without saying, but for everyone to be on the same message. And we heard about that this morning, actually, also in some of the panel conversation. It became really, really important, particularly if we wanted to engage with politicians and all the way down to our community members, that we spoke in a way that was similar. So it may have been scripted in a different way, but at its core, the message was still the same. But we scripted it and shaped it according to the audience. And I think that plays out in certainly when we start to think now about the preventative space and the ambitious journey that we're about to embark on, that messaging will become really, really important. Definitely trust. Trust, as we know, is at the core of any good relationship, whether that just be with your partner, with your family, with your community. It is also, was the deal breaker in the end. I could pretty much get most things over the line, and that was based on, I guess, the relationship that was founded on trust that I had with all of the entities that I needed to work with. And probably the third thing was that we don't shy away from the robust conversations when we don't have the same perspective. Doesn't mean that our values have shifted, but we may see things from a different lens and be very mindful of our blind spots. And I think that is the thing that probably held us in very good stead. But also, it's about, I guess, what partnerships bring is the different perspectives and the different strengths, because you can't be the all-singing, all-dancing expert at everything. And that's the richness, I guess, of the quality and integrity of partnerships that, that we can build.
Okay, thanks. So thanks for those reflections, particularly on the COVID response. Tiani, I'm going to come to you now. So your team led the development of Queensland's first ever physical activity strategy, Activate Queensland. Well done on that. And that's ostensibly about physical activity and belongs in the kind of Department of Sport and Rec. But it does, of course, have actions which span right across the sector. And so can you reflect on the process of both agreeing with those partners what actions they would deliver and also moving from strategy to implementation? Just a small question for you there.
Yeah,
Tiani.
tiny question. Thanks very much, Mark. I guess one of the things that having a strategy has done is made, I guess, what sport and recreation is trying to achieve really overt. We've got targets in there, so we're, like Robin said before, they're laser focused, we're laser focused as well. And that's really helpful for our partners to understand where we're coming from before they come to a conversation, because that's, you know, that's a commitment, a government commitment. And then it's about making sure that we have these really good value-based relationships. No, you know, not one organisation is ever going to be able to deliver on Activate. We can't deliver on Activate by ourselves. It's about what the sum of all the parts are. And I think, you know, on what Sandy was talking about before, you know, being able to talk to your partners about what are the things that you need to tell the story. That's so important. And I think the other thing is about partnerships is more than just a funny relationship or even just a relationship. It's about, you know, what are the assets and what are the different considerations someone can bring to the conversation, and what are the audiences that they bring, and what are the partners that they bring. You know, it's such a multifaceted, and when I was listening to the panel earlier, I was thinking about, you know, how complex and multidimensional the challenge that is in front of us, but partnerships is also complex and multidimensional, and maybe that's how we get the cut through.
Okay, thank you. I'm going off script a little bit here, so this is not a question that was in the question list, but I was encouraged to do so by Robert backstage, so thank you, Robert. I'm going to attempt to bring some themes from this morning into this question, and I might not do a good job, but equity is really at the heart of what Health and Wellbeing Queensland is doing. Equity is a very complex area and is described as such. It's understood in different ways to different people. We've heard particular framing this morning. We've heard the social determinants of health framing, the fundamental causes framing. We've also heard the lifestyle drift type framing, where it's about individual responsibility. If the action that is required is needed across a whole of system, going to John Kearney's point earlier, how do we ensure consistent framing so that when we're talking about poverty and inequities and these fundamental drivers of poor health, we don't end up with solutions that are about putting healthy messaging on buses, for example? How do we bring that framing in a consistent way so that everyone, as you've said earlier, is on point with the same message at the same time? Who would like to go first?
I'll have a go.
Thank you, John.
I think that's a tough one, you know, because what we were talking about this morning and what the panellists were talking about was culture change. And we were also talking about a joined upness in terms of, from a government policy perspective, but also taking the community with us. And I think when you think about trying to shift the way our whole community is shaping itself, it's a real challenge. It was interesting that Dr. Norman Swan mentioned the voice this morning and talked about the importance of the voice in terms of a bigger community change. And I think, I don't particularly want to enter into that world, but if you take something as big as that, it takes an enormous energy from all of us to make a culture change. When I bring it back to my own organisation, one of the things that we try to do, as you suggested, Tiani, is how do you bring more partners on board and how do you bring their audiences with you? And that's one of the big shifts. You know, some of the early learning we found was that we came from some scholarship that came out of the United States in terms of thinking about the organisation as bringing the best public good that it could deliver. And there's a model in how you do that, and understanding that framework in how you take the authorising environment, which isn't necessarily the politicians or those that give you money. It's actually the general community who authorise the politicians to frame the policy. How do you take that authorising environment, the general community with you, on a journey, and how do you articulate the outcome that you want? In the case of Health and Wellbeing Queensland, all of us here, I'll bring it home to myself, right? We're a big cultural institution that wants to aggressively develop long-term relationships with as many Queenslanders as possible. One of the really big issues for us is that here we are sitting in Brisbane and we need to be able to connect with all the people across Queensland. it's not physically possible for us to do it alone. So what we have to do is find like-minded people throughout the state that can enable us to do that. Because what we want as an organisation is the culture change that everybody has access to the arts. See, we believe deep down that what the arts offer is two things, and I think those two things go to the heart of what we're talking about and sit alongside the objectives of a general well-being for all the state. One is the arts help us build a sense of community, and in that they also help us build a sense of identity and a sense of belonging. And what we want to do is connect people to each other in community and to talk about all those really difficult issues that move us along as a society. All of us as parents, or whether we're not parents but know young people, know that the steps we take can make a difference if we walk together.
Thank you, John. Robert, I'm going to come to you now just to continue and build on that, because you're Head of Comms, Executive Director of Communications, and previously Head of Comms in the Health Department. What are your reflections on framing messages, particularly in the prevention space, if that was anything that you got involved in during your time?
I think probably a couple of things, and I think there's probably real value in, and this will be important for partnerships, I think probably looking back over some of the biggest progressive developments of the last couple of decades. So whether it's, and there is an awful long way to go, and things are far from perfect, but look at sexuality, look at gender, look at race, look at disability, and I'm disabled and can speak to that a bit. There's been a huge progress in a generation, and huge changes inside of a generation. So I think it's probably there's a couple of lessons out of that. I think framing the discussion in a positive way, and I think that's one of the big challenges for everyone here. You know, it's not about the things you can't do and shouldn't do. It's about the options and the lifestyle and the things you will experience if we can all act differently. So that's one thing. And then the other thing around the partnerships. I mean, I think even a lot of issues that I may want to engage in, whether it's in my social group, at work, on social media, which can be scary sometimes. I'm tired. It's really tired. It's really tiring fighting for things that matter. And I think that's why if we have those really good partnerships that are based on our objectives and our values and a really good trusting relationship, you know, when I drop the ball or when I have 2 months off work because I still haven't recovered from doing my work during COVID, someone else can pick up the ball, and we're going to need to do that for, you know, 20 or 30 years. And certainly, you know, the links I think have been made before, but there's plenty of academic literature on, you know, what's the journey been around seatbelts? And, you know, how does that translate to a conversation around health and well-being? And there's a whole bunch of interventions there, as there have been with tobacco, but a really broad conversation. And I think looking back to try and understand how we can get the most value out of those partnerships is really valuable.
Okay, thank you, Robert. So that kind of conversation touched on both the kind of policy levers at the kind of state level or national level. Let's bring it down to the community level, because community has also been mentioned. And Sandy, I'm going to come to you. There's a big focus now in Queensland and nationally on place-based approaches and community-led approaches. A good example locally here is in Logan, the Logan Together movement, which the national place-based evaluation framework was based upon. Given the work that you're doing, have you got any reflections on the success factors for place-based approaches, so really working with community to develop their own solutions?
Yeah, absolutely, Mark. I think our experience on that has been in some ways led by Health and Wellbeing Queensland, because we're working on a co-design process with support of Health and Wellbeing to do some healthy food and nutrition education with young people all around our model, which is hands-on learning and cooking. So when Matt's making those rice paper wraps and telling stories of how the young people engage with him, we see that. Like, the way he cuts the avocado, the way we've seen young people concentrate when they're dosing out olive oil to the right measurement as per the recipe and engage in making meals, those independent skills that will give them the confidence to take that forward. So this is real local level in communities has been fantastic. So our young people have had input into the first 2 pilot programs of Fuel Up, which inform how we'll take it forward. We've had feedback from parents and guardians and schools about how that experience around the food has been received. Likewise with our bike riding stuff, it's I think Norman talked about like this loneliness, this chronic stress and the negative health impacts. What we see a lot in young people is isolation and loneliness is felt very painful. It's not cool, and we provide that environment where the young people get a sense of belonging. Riding the bikes in terms of the Activate Queensland stuff, like we play a humble little role in getting kids on bikes, and sometimes those bikes just don't keep them active. They actually get them to safer places. That we've heard horrific stories at night where they might leave home to get somewhere safe. So these bikes and this mobility is really important. I think for us, it's engaging the local community around our young people, whether it's the Lions Club, who chip in a bit of money for the food, for our young people, 45% of which turn up without having eaten breakfast and come with no food for lunch. How you learn on an empty stomach, I don't know, but whether it's the Lions or whether it's the local business that gives an apprenticeship to a young person who's got confidence through the skills they've built, for us, it has to, like, I got to admit, it's complicated, some of the issues raised this morning. I guess all we're trying to do is take some action like that at the local level that we can showcase maybe what some of the possibilities are and the positive outcomes that we can achieve working together, and then learn as we go, and then try and reach more in the community.
Yeah. And so you're quite new in your role at Diabetes Australia Queensland, but your organisation is responsible for the My Health for Life programme, which is a statewide programme to improve health behaviours. So I know you're new, this may be an unfair question, but how does My Health for Life go about that engagement process to ensure it's reaching or it's being made available to all Queenslanders?
Yeah, no, great question. So yeah, we're very proud and privileged to be the lead agency and funded through Health and Wellbeing Queensland, and we have amazing partner organisations that work with us in order to be able to, I guess, ensure that we have reach and understand, I guess, the demographic in which is the most vulnerable, where we can potentially have the greatest impact. And that's where certainly the role of partners becomes really important, and that place-based, I guess, arrangement, because it's great to sit in Brisbane and kind of go, oh, there's some stuff happening up north, how do we do that? So it is about getting out and about leveraging the relationships and networks that our partners have, building capability that is within the community so that they become self-sufficient, and you leave that legacy long beyond potentially this program being funded or this program actually evolving as we learn, as the data informs us that we need to be doing something different, as we are certainly starting to make some fantastic impacts. I think for me, one of the really interesting things is that we need to relearn how to bring ourselves back into meeting and having conversations with people face to face. You know, what probably most of us experience is that we can jam a whole lot of meetings into a day now because we just go from one Teams meeting to the next and, you know, run to the loo in between, grab a drink when we need it. And we've forgotten how important it is to actually sit in a room and engage with people, because that's how you use all of your senses to understand, to build trust, to understand responses that maybe aren't being verbalised, but you can absolutely see and feel that there's something perhaps not sitting quite right that you need to have a further conversation about. So it's for me, it's really quite interesting kind of coming from, you know, the COVID world where everybody's kind of locked up to now trying to encourage people and even accepting meetings and saying, I'll come in person, and people will go, oh, well, we better find a room then, because we've forgotten how to do that. And I think if we really want to ensure that that we are culturally appropriate, we need to give that really good consideration, because we know for some cultures, the only way to really build that relationship and strengthen that partnership is to get in a car or get on a bike or get on a plane and go and meet them face to face and have that conversation.
Yeah, and if I just reflect on some own personal recent experience, I was up in what I say is Cairns, and nobody knows where I've been, Cairns, last week. And a participant at that particular workshop, who was an Aboriginal woman, said that we have to move, she felt the workshop was moving too quickly and that we have to move at the speed of trust, which I thought was a fantastic saying. And I think being able to move at the speed of trust online is far more difficult than it is face-to-face. We've got about 50 minutes left. I'm really keen to get some questions from the audience, but before I do that, it would be remiss of me as an evaluator not to ask questions about evaluation. We've heard this morning about measurable outcomes. John, you've just mentioned the importance of measuring the success of a partnership, not at the end, not post hoc, but whilst it's happening. Tiani, I'm going to come to you on this one. As a government department, do you have anything in place, or are you aware of any assessment that is taking place to measure the strength of the partnerships that are so important to the delivery of your strategy?
Yeah, thank you, Mark. The short answer is yes, but the longer answer is we have a similar monitoring and evaluation framework that we have developed and implemented that sits underneath Activate Queensland, and I guess all of our financial arrangements with any partner have a whole raft of deliverables that sort of feed up into that outcomes framework. And where it comes to a non-financial partner, it's far more about, well, what's the value proposition that we've got here? What are we trying to achieve? How do we measure that? We've sort of been doing that with Health and Wellbeing Queensland. We sort of created almost like a dashboard of a yearly success factors, so we can sort of reflect on what we've achieved together, where we think the opportunity is to move, in the next 12 months, which, like Sandy said, sometimes the opportunities are so big, you have to be really, really tight on what are the things you're going to go after, because you don't have the resources to do everything. But it's about being really clever about, okay, well, which one of these is the more bang for buck, and so how do we move on that?
Okay, and if we were to develop a measurement tool for partnership, there are a couple out there, so Vic Health have developed one. What would be, and I'll come to each of the panel members, what would be the top 3 constructs, for want of a better word, that you would like to measure that would tell you whether or not your partnership is strong or not? You can go first, because you've got the mic at your mouth, Tiani.
I think a way of measuring your collaboration, so the impact of that collaboration, so what are the things that you were able to achieve together that you wouldn't have been able to achieve by yourself? Harder to measure, but probably actually the real value of a partnership is how much has the original scope changed for the better? Because you come to the partnership with an idea, they come with an idea. The whole point is to collaborate to a point where you're like, oh, this is actually what we're trying to do, and that's the magic. I know you asked for 3, but I think those two together are the things that I'd actually be really keen to have a measurement for.
Fantastic, thank you. Robert, would you like to go next?
I reached for the microphone.
You caught my eyes.
Exactly the wrong time. I think probably I'd be really keen to see, and I'm sure we could put some metrics around it. I think what do the people delivering the work on the ground say about the partnership? So I think it's really remiss of organisations if they don't actually, because it's easy to capture metrics. There's plenty of data, and you can get all sorts of numbers. But I think actually a bit of that qualitative understanding in terms of, going to Sandy's people and go, well, tell us, did this partnership work? And getting an explanation and capturing that. Then I think, and this is probably a bit of an odd one, I think have the organisations increased their storytelling prowess. I think, there's another challenge for all of us to resist the urge to try and convince people and sway hearts and minds through datas and dollars and numbers. I'm sure John could probably recall off the top of his head numbers have been through the precinct, what the top shows have been. But that's probably nothing about capturing a story about a performer who got their first gig in a show in Mary Poppins in the chorus. It's probably nothing about capturing stories around a family who are able to bring a grandparent for one of their last trips out. And I think that's really important to actually have that really virtuous feedback loop for our people who are doing the work for us.
Super, thanks, Robert. Sue, Sandy, or John, who would like to go next? One or two will be fine. Key constructs, preferably a different one to what's been said. So we've got a questionnaire developing here.
I wonder about, we do pulse surveys in our organisation, even a simple question, would you recommend this partnership, to somebody else? I think can sometimes be a really good measure. And I think there's probably something even really quite simplistic in terms of your partners actually turning up for the things that you host, whether they be steering committees or functions or whatever else. To have them engaged and present, I think is a really good measure of the relationship.
Yeah, and I think today, given how many people are in the room, is probably credit to Health and Wellbeing Queensland and how well they, in their few years, have established numerous partnerships. Sandy?
I just think it's some of the unexpected benefits of partnerships that you might not have been on the original terms of reference, but become those stories, which is when the partnership's growing into areas and possibilities that you didn't have on the radar, and those can be possibilities for learning as well and character building, but they can also be unexpected in a positive way, can't they? So referrals onto other partnerships, turning up for steering. In our case, it's like the young fellow who catches 3 trains and rides his scooter to get from Carindale to James Street to attend a Merlot coffee experience as part of an extra industry pathway thing for him. And you go, how resourceful is that young person to do that? And how didn't they appreciate the opportunity that partner was providing? So it's nice to hear some of those stories.
And if anyone's looking for some inspiration on their commute home later, I suggest you Google Sandy and Traction. There's a 5-minute YouTube video where it gets into more of that. John, last reflections from you on terms of measuring partnership success.
I'd just like to endorse everything that's been said, because I think it's the building of the relationship that counts. And just to tell you a little story, QPAC is a big driver of the nighttime economy here. And about 6 months ago, coming out of COVID, one of the local businesses said to me, "John, we don't need you anymore." And I thought, how fantastic was that? He's not saying go away. He's saying we worked together and we're successful, we can stand on our own. Thank you. And I think if the relationship that we form with our organisations reinforces the strength that each other brings to the table or has the capacity to help each other grow, that's probably a really positive outcome.
Fantastic, thank you. Okay, we've got about 7 minutes left, so time for a few questions, I think. Do we have any in the audience?
Talked a lot. Hi, I'm Andrea Sanders from the Stroke Foundation. Talked a lot about partnerships and the impact that they make in supporting community or delivering services. I'm interested in knowing your feedback about where you feel the consumer voice fits or the person with the lived experience, and how you see them supporting the impact in their partnership with your organisations.
Would anyone like to?
I'll have a go
John?
at that. An institution like ours has to reflect the community that it serves, right? So it's got a lot of social outcomes and it's got to connect across the board with communities. But it also has to have a lot of commercial outcomes. So 10 years ago, our total attendances were around 600,000. Now they're 1.3, 1.5 in any one given year of paid attendances. And that's come through being really clear with our business partners what the objectives were for them and for us, and adjusting sometimes our practices or their practices to actually get that. So what I'm talking about isn't financial success, is the cultural change that drives the relationship and ultimately drives an outcome. And part of that outcome is actually measuring community sentiment. And when I'm talking about community, I'm also talking about patrons who come here, and it's really expensive to come here on something. You know, like to go next door, it's frighteningly expensive. You know, I'm really conscious of that. 2 adults and 2 children to go to Mary Poppins could be an $800,000 expenditure. Sorry.
There's some good seats.
There's some good seats. Could be an $800 expenditure. That's a really big challenge for any for people, whether it's a family or a group of friends. It's a really big. So how do you make that investment on there pay off for them? You know, so I think there's a really important conversation that you have to have with your commercial partners about what your outcomes are, what their outcomes are.
Okay, it's a great question. I'm going to go to our government colleagues at the end here. So in Scotland, Scotland was devolved additional powers in the past few years to develop its own social security system. So just particular benefits were devolved from Westminster. And so the Scottish Government, which many would say is more progressive than the current Westminster government, established a lived experience panel. And that lived experience panel is having a genuine voice in terms of the shape of how social security is being implemented. It's a very humanistic approach to ensure the services are caring and supportive and not demonising and so on. From your experience working in government, where are we at in terms of engaging those with lived experience into the policy making process?
I think we are on a journey on that, to be honest. I think that so in sport and recreation, we have got some contingencies in our partner agreements with state level sport and recreation organisations and peak bodies, which is about making sure that they do have member satisfaction and protection in place to make sure that people who are, undertaking physical activity have a voice, have a way of giving their feedback, and also are protected. We talk a lot about safe and inclusive experiences in sport and recreation, but sometimes we're really challenged to actually see that voice, because we rely on external deliverers. In places where our service delivery teams are working much more closely with community, with local governments, we actually can have some self-determination in those particular communities on their programs, but that's an evolving space, and I do think that whole voice, and I'm not just talking about First Nations or people with a disability, it's about anyone who has a barrier to having health and well-being. What is that barrier? What are those challenges, and are we addressing those enough? And we need to constantly evaluate that we're doing that enough.
Thank you.
I think just really briefly, I think there's probably a difference between the agencies that have a direct and really large interaction on a minute-by-minute basis with the public, health, education, police, transport and main roads, to some of the other agencies. And I think we probably have to make sure that whether it's in the communication process or the policy development process, that understanding of where the public's at, where our people are at, where the community's at, where the consumer's at, it's really important. And I think it's probably some parts of government do it better than others.
Okay. Thank you. I think we've got time for 1 or 2 more questions. Any more in the audience?
I suppose, Haren from the Australian Institute of Play. I've been affiliated with Logan Together and Collective Impact Model, and I spend most of my time invested in the community of Logan, increasing physical activity and physical literacy opportunities for children, largely through play. We've heard a lot about agency, and in terms of partnership, my question is, how do you evaluate agency and partnerships growing from a community level? And what role do partnerships have in building agency at a community level?
Okay, great question. Sandy, I'm tempted to come to you first, just given that you are working very much at that community level.
I am still thinking about that one. I think trying to find out what the community needs are and take feedback from consumer stakeholders about whether we're bringing value to it, narrowing in on where we can make a difference, and then lining up for a good fight on those issues and mobilising forces with others who are playing in the same space. And I guess certainly I personally believe it'd be nice to leave the planet in a better place than it was before, and also that every young person deserves a chance. So I think around health and well-being in a broader context, with that and climate and inclusion, I think these are pretty good things to have a go at. And I guess my encouragement from today has been around, we've got to let people know as a community what's important to us and get the messages right and get on the same page. I think it's worth fighting for.
I wonder if there's even a step that is potentially before that, which is the co-design process, so that we've still got a lot of learning to do. I think in terms of what we think is the way in which we engage consumers, communities, and there is a piece around ensuring that we have the capability and understanding that it's not one size fits all, that we actually need to have different approaches. But I think in terms of evaluating, it is about co-designing and constructing, but at the same time you are also co-designing what it is that you want to measure that determines that you've actually made an impact and made a difference. And that's done together with the voice of consumers, rather than developing something and then taking it and saying, what do you think? Because that is not co-design, and it's probably incredibly disrespectful, I think. So I think, we still have some challenges around what we think is this thing called engagement with community and consumers. Yeah.
Okay, great. And again, it reminds me of recent workshop experience where a participant said, it's nice to be informed, but it's much nicer to be involved. And I think we do need to do that better, even with the constraints we often have in terms of the timescales for policy delivery or project delivery, whatever that may be. There's a big message in front of me saying time to wrap up, please. So I think it's time to wrap up. Can I just ask everyone to show their appreciation for the fantastic reflections of the panel? And thank you for the excellent questions.